a lot of the work for you. In traditional sinus surgery, you have to remove pieces of bone and pieces of tissue, then you get scar tissue that develops. With the balloon sinuplasty, you get the balloon into the sinus opening, it inflates the balloon, and that just pushes the bone. So it does microfracture the bone into a new configuration with a larger hole. So basically it's a less invasive way to treat the sinuses. And we've learned over time and with much study that preserving the sinus mucosa, especially the mucosa around the area where the sinuses drain, it's very important. The mucosa has cilia on it that helps move any mucus or fluid or infection out of the sinuses. And so if you destroy that tissue and cause too much scarring, then even though you have a large opening, the sinuses are non-functional. So this is a very minimally invasive first approach for the sinuses. Usually the next day they're back to work. Sometimes they have a little bit of drainage, but nothing compared to traditional sinus surgery. With traditional sinus surgery, there's a lot of bleeding, and so there's a lot more drainage. There's more tissue that's removed, so there's more of a wound inside the nose. And with these patients, there's just not that degree of trauma during the surgery. And so they don't have as much drainage, they don't have as much swelling, they don't have pain. He's a long-standing patient of mine. He has hearing loss, and I've been treating him recently for perforation of the eardrum. We found on a CAT scan that he also has chronic sinusitis. You can see in this maxillary sinus he's got fluid or maybe some swollen tissue. In this sinus, maybe some evidence of prior infection at that time. He describes having a lot of drainage from his sinuses going back down his throat, and he's been doing sinus rinses, antibiotics as needed, nasal sprays, and so this is the next step. I recommended in-office sinus surgery with balloon sinuplasty and also a turbinate reduction. What I usually do to screen patients for in-office surgery is I just do a nasal endoscopy, and I insert the scope all the way back to the very back of the nose and all the way forward, and I just see how they tolerate that procedure. He did really well with that. I also felt that there was plenty of room to work within the nose, and I just felt he was a good candidate for it. The turbinates are the tissue inside the nose on either side of the septum. They swell off and on when you get congested. And the turbinate reduction is where you remove some of the tissue from within a small hole, and you create a small tunnel, and you remove that tissue to help it so it doesn't swell as much. So once it scars, he should be breathing better as well. So we talked about doing the balloon sinus of both the maxillary and the frontal sinuses, and also the turbinate reduction. So we went over this already, but I'll just show you again. So basically, these are your frontal sinuses here. You can see some of the inflammation in the sinus there on that right side. And this is the opening to the sinus here on either side. So the balloon's gonna push the bone and make that opening a little bit larger. And then we also talked about that maxillary sinus, that's sinus behind your cheekbones. How that one's full of fluid. We'll check for fluid today. We might rinse it out. We might not have to do that. So, but you can see evidence of the inflammation from both of these sinuses here. And
that's why they're different colors, because this one's got fluid in it?
Exactly. Normally it's air-filled, so it looks black like that. And the lining is bone, so you only see the white on black. But if you see the gray, that's evidence of fluid or inflammation, like in the sinus right here. So, okay, so that's what we're going to do. I give them pain medication and anti-anxiety medication and anti-nausea medication just before the procedure, and it helps get them into a nice calm state. But they're still fully awake during the procedure. Before you came today, you took the pain medication and also the relaxing medication.
Was that relaxing? I thought it was
Yeah.
So you didn't get sick?
Oh, there's the anti-nausea one. Did you take all?
Oh, Valium?
Yep. Did you take the Valium as well?
I took one about an hour ago.
Okay. Do you feel pretty good right now, or?
I'm fine.
Okay, and you already took the anti-nausea one as well?
I just took it about 15 minutes ago.
Okay, perfect.
One of them.
Okay. I'll put the numbing medicine inside your nose, and it'll just sit there for a few minutes while you're getting ready, and then we'll move you to the other room, and then you can say goodbye for a moment to your son. So I'll just put this inside the nostril there. And put it here. Okay. Make sure it's in there good. Okay, so we'll let that sit for about 5 minutes, and then we'll move you into the other room, and we'll get going.
Okay.
Oh, and is there a certain type of music you like to listen to? Because I usually have that playing for my.
He's into heavy metal.
I don't listen to music anymore. I'm deaf.
Well, other than that. But, okay. Well, you don't mind if we listen to music,
You
do
do
you?
whatever you want.
What type of
Okay.
musical vibrations do you like?
That's right. Okay. All right. Well, if you recognize the music, then I'll be impressed. So. All right. Okay. Well, we'll see you in just a minute. All right. Come with me.
See you, Jess.
Have fun.
And yeah, so we're gonna go this way, and the waiting area is just over that way.
Thank you.
Okay. Here's Thomas.
Okay.
Okay, just have a seat here. She's gonna grab that thing.
All right, Thomas, I'm gonna put this around your neck. How are you feeling?
I'm okay. I'm fine.
Good.
Do you recognize this music, or can you hear it?
I can hear a little bit.
I'll be impressed if you know who it is. But no pressure. See that cuddle? You might taste some of the medicine in the throat a little bit. That's pretty normal. Okay. Okay, we'll let that sit for about 5 minutes, and then I'll come back and we'll do the injections.
Yeah.
Feel a little pressure. Try to show the screen a little bit too. Oh, she's recording right now. Take the balloon here and we make sure it's bent for the frontal sinus. Just like that. Okay.
With all the time to
Okay, let's see if we're in. You want to turn the light off and show that?
Yes.
Okay, you can see we're in the maxillary sinus. The light's illuminating the maxillary sinus. Okay, that's good. Go ahead and inflate. That's good. Come down, inflate. That's good. Come down, inflate. Great. irrigating the saline in there and it's suctioning it out at the same time. Yeah, that's good. So I'll make a small incision there. Okay, take the caudal. I felt a little more pressure for this part. Okay, now to the section. That's good. I'll take the freer. I'll take that. The voids out of there. Okay, how do you feel?
I feel fine.
Good. All right, so we were just talking about this. So you didn't feel any pain during the procedure.
No, no.
Okay.
No, no, no.
Procedure took a little more than an hour. So everything went as planned. Now today, he actually had. We didn't see fluid on the right side, but we had fluid on the left side. So the CT scan at one time doesn't always show you what you're going to find. And this is the opening to the sinus. We put the balloon in, and the balloon pushes this bone this way and this bone that way and makes the hole larger. These are the inferior turbinates. This is, we did the turbinate reduction, submucous resection. So we made a small incision in the front, went in there, and we resected some of this contractile tissue here. It will help him breathe a little bit better. So, all right. Some people, they get the same procedure done, but they get it in the operating room with
Right.
general anesthesia. What do you think about getting it in the office today versus?
Well, like, I didn't have any problem with it. I suppose if you were somebody that panicked, it might bother you, but
Yeah.
I was fine with it.
Okay, very good. Yeah, everything went really well. So, do you guys have any other questions about afterwards? So.
Just ask one.
Yeah, can you still walk?
Yeah, it was funny, we were done with the procedure and he said, okay, and he just got up and started
Well,
walking away.
I was asking him how long until like all swelling or anything goes down to where he knows it actually fixed whatever problem he was having.
Yeah, so it takes about 2 to 3 weeks for the healing, for most of the swelling to go down. And then you'll notice a difference anytime during that time period as far as your breathing goes. As far as the sinuses, over time we'll know.
No.
If you get the sinus infections less often, or you have the facial pain and pressure less often or less severe.
I think someone said something about nothing real strenuous for a week or so. Is that so you don't?
I would say don't blow your nose. You don't want to force air into those tissues while they're healing for the next week or two. And I would say no heavy lifting for the next week.
Is that sort of blood veins or what? So
Yeah,
blood-
because when you lift, you basically increase your blood pressure, and you increase your local blood pressure to the nose, which can open up the veins and cause bleeding.
So don't do sinus flushes for a while either?
For the first week, I usually have you just use the saline rinse, so just a nasal saline, so just squirt it, just the spray.
About the,
And then
about
after
the
that, you can do the rinse
What
after
about
the
the-
first week. I put some absorbable dressing inside your sinuses and by the turbinates.
Oh.
That will dissolve with the saline spray.
Oh.
So that should be gone when I see you back. So,
Okay.
and I should have given you a prescription for an antibiotic
I have it.
and then a pain medication as well.
I have it.
Okay, so you can use that as needed if needed. And you might have one more pill for the nausea medication if you
Yeah,
have
I've
any
got one
nausea.
left.
Okay, do you feel nauseous at all
No,
now?
no,
or-
no,
Okay. All right, so you don't have any pain right now?
none.
Okay, so you don't have to take that until you get home and you start to feel something. Sometimes we'll have you take some of those medications right after the procedure. So let's plan on seeing you back in 3 weeks,
Okay.
and I'll take a look in the sinuses then, and we'll see how it looks.
Okay.
I think you're gonna
You'll
do really
just
well.
like take a peek, no scans or anything like that. Just, you'll
We
just
shouldn't have to do another scan unless you have a problem, but when I first started doing this, I was basically treating patients the same way I did when I took them to surgery. So I would see them back in 1 week to debride the sinuses or clean out the sinuses and remove scabbing, remove anything that might help prevent healing. But what I found when I had them come back that soon, they looked really good. They looked almost back to normal, and so I found that they just heal much more quickly. So there's no need to see them that soon and to debride the nose as often. So I usually tell me about the recovery.
There wasn't any recovery as far as I'm concerned.
Okay.
I went home and went about normal, pretty much normal, my normal business right
Okay.
immediately.
Did you have any pain or any significant drainage from the nose?
I had zero pain. It was the plugs that were put in there. They were pretty irritating for a couple days until they came out. They came
Okay.
out by themselves, but
Okay.
they were just made me feel extremely stuffed up until they worked their way out.
Okay. Then the breathing got better after those came out?
The breathing through my nose, yes.
Kind of depends on the patient, the severity of their sinus disease, but this, the patients that I've seen and taken care of, when we treat those sinuses that they're having trouble with, they'll do really well. I'll see them back 3 months later, 6 months later, a year later, and they are having less sinus infections or no sinus infections, and less sinus pressure and pain as well. So. Okay, now you're still having some symptoms now at 3 weeks. Tell me about that. Is it the pressure you're feeling?
No pressure. Maybe a week or so ago I had a little bit of pressure, just a little bit above my eyes.
But that's better now?
Yeah, I haven't noticed it now for a few days.
Okay.
Anyway, I wake up in the morning stuffed up, but I think that might be it could be allergies, I'm not sure.
And you're still having the postnasal drainage, is that what you were saying?
If that is postnasal drainage, yes.
Okay.
If that is.
Okay.
I'm not sure if it is or not.
Okay. Well, it can take time to notice the full results from the balloon sinus case, and basically you should feel better, month or two afterwards. You should, the main thing is decreasing your infections. If you're not
Right.
continuing to get infections, then
I
that's
guess
a success.
the real answer will be is next time I get a cold, if I get an infection after the cold.
Right, if it doesn't progress to, yeah,
Right.
that's right. If you're able to control it with the medical management and everything, so. Okay, so next what I typically do is see you about 2 months afterwards to evaluate the sinuses, see how you're doing at that point. And then we can look at everything else at that point as well too. So, you don't remember any pain from the procedure or?
There was no pain anytime,
Okay.
before or during or after. No.
Would you recommend this to anybody else or?
If it helps, yeah.
Okay. So what did you do that was atypical for my patients after the procedure?
My son was giving me a ride home, and on the way home he asked me if I wanted to stop for a beer, and we did. We had one beer, but my nose was bleeding a little bit, so I had left before I before I dropped a drop of blood on the floor or something. But I felt fine.
But you just had one beer. Okay.
One beer, yeah.
Yeah, I usually don't recommend more than that. So.